called the activator. It fires at 1/1000th of a second. It's very fast. My hands are about a second. I know both techniques, the manual technique and the activator technique. I prefer the activator because it's a high-speed instrument. It fires at 1/1000th of a second. So it's similar to the principle of a bullet in a gun. If I take the bullet and I throw the bullet as hard as I could against the wall, hits the wall, falls on the floor. If I take a gun and I fire it with that same bullet, it'll go through the wall. The reason it goes through the wall is not force. There is force in both of them, but speed is the main difference. So that's how the activator works at 1/1000th of a second. The activator is also much more precise than hand adjustments, and I'll explain to you how that is. If I need to move the bone in that direction, I put it right there and I move it that way. If I need to move the bone in this direction, I just put it right there. So there's about 8 different ways I can move a bone with the activator. If I utilize my hands, I'm not sure which vertebra moved. This one could have moved or this one could have moved. And I'm not always sure of the direction. It's about 60-40. This is 100% of the time. I know what direction it's going and what vertebra is moving. Any spinal condition, so it can be anything from like headaches, neck pain, pain radiating down into the arms and hands, pain in the low back, pain in the mid back, sciatica, pain, that means pain into the legs, numbness and tingling in the feet. So these are all part of some of the things that you can treat with activator. I'm what they call advanced proficiency rated activator method practitioner, and that's the highest rating in activator. And I've been to 50 of these seminars for certification over the last 48 years. The activator is the safest way of adjusting somebody. It's very safe. And the only thing that happens sometimes in the beginning when we start off, the person gets a little sore after the first few treatments, and that's perfectly normal because the body's starting to change. It's almost similar to like if you've worked out and a few days later you feel sore. Is that a bad thing or a good thing? It's a good thing because your muscles are changing, they're getting stronger, so you're feeling the muscle actually change. In this case, you're feeling the release of nerve pressure as we adjust So here we have medical treatments here and we have therapy treatments here. So we utilize the activator with the therapies that we have here. There are multiple therapies. We have laser, we have ultrasound, we have decompression, we have vibrocuss. There's multiple therapies that we utilize with the activator method. Like I was mentioning before, they may feel a little soreness after that first treatment. I think that happens in about 50-60% of the patients. But like I said, that's a normal thing. It's a process, you know, it's not just one treatment. We don't give one treatment, we give a series of treatments to get things back in place. A lot of these things have been out of place for many years, so it takes time to turn these conditions around. I've seen so many success stories. We'll use sciatica as one. So many patients, 1,000 patients I've taken with care of sciatica. It helps tremendously with sciatica. The treatment that, one treatment that I can remember, that was a little baby that was not able to breathe, and he had been to Yale, New Haven, to hospitals all over. They're checking his heart and lungs. They couldn't find anything. And what I found was at his brainstem, the vertebra right up here, it's called the atlas, it's the first cervical vertebra, was out of place. He came in not able to breathe. He was, as soon as I made the adjustment on with the atlas, with the activator, he immediately relaxed and his breathing went back to normal. So this is the autonomic nervous system. What that is it's the brain, the spinal cord, and the nerves that emit from there. So every function in your body is controlled through the nervous system. Messages are sent from the brain, they come down through the spinal cord, and they come out through the spinal nerves. When you have problems with ones in the lower back area, it can affect the low back. It can also affect like the intestines, the bladder, the sex organs, and into the legs. Up in here, it can affect into the head, like headaches. Okay. This area actually affects your whole nervous system because it can put irritation on the spinal cord right here and affect the whole nervous system. So you want that vertebra to be in perfect alignment. Down in here is the neck area, but it can also affect down into the arms and hands, tingling, numbness in the arms and hands. That also goes to your heart and lung area. So every organ in the body has nerve supply that comes from the nervous system to control it. So if these vertebrae are out of alignment, they irritate those nerves, and those nerves don't flow properly to the area they should be going.